1900, Battle Creek Health Resort, Michigan. Dr. John Harvey Kellogg witnessed something extraordinary unfold with his senior patients. 3 nights prior, he initiated a simple experiment. He asked 47 patients all over the age of 60, each grappling with fading eyesight, difficulty reading and trouble seeing at night, to consume one particular fruit before bed. Not just any fruit, not at any time. This exact fruit, at this exact time, before sleep. The results, meticulously documented in his medical journals, shocked even him. Within 72 hours, patients reported clearer vision upon waking. Within 1 week, 34 out of 47 could read without squinting. Within 2 weeks, night vision, which had been deteriorating for years, started to return. Dr. Kellogg wasn't guessing. He was one of the most respected physicians of his time. Battle Creek Health Resort wasn't some fringe clinic. It was where presidents, leading industrialists, and the medical elite came for cutting-edge treatment. And what he discovered about this purple fruit and the human eye would take modern science another 100 years to fully understand. But here's what really matters to you right now. If you're over 60, if your vision is getting worse, if you struggle to see clearly when you wake up, or can't drive safely at night anymore, this discovery from 1900 is more relevant today than ever. Because while Dr. Kellogg didn't have electron microscopes or genetic testing, he got the results. And now, Harvard Medical School, the National Eye Institute, and leading ophthalmology journals have confirmed exactly why this works. In the next several minutes, you'll learn the exact fruit Dr. Kellogg used, the precise timing that matters, the scientific reason it repairs eyes during sleep, and the modern protocol validated by peer-reviewed research. This isn't folklore, this is documented medical history, meeting cutting-edge nutritional science. First, let's understand what's actually happening to your eyes as you age. Because once you see the mechanism, Dr. Kellogg's solution makes perfect sense. Your retina, the light-sensitive tissue at the back of your eye, contains about 120 million photoreceptor cells. These cells are like tiny solar panels, constantly converting light into electrical signals your brain interprets as vision. But here's the problem. These cells are under relentless attack. Every single day, your retinal cells face oxidative stress. Light itself, especially blue light, generates free radicals. These unstable molecules damage the delicate cell membranes, the mitochondria that power each cell, and eventually the DNA inside. It's like rust slowly corroding metal. You don't see it happening. But year after year, the damage accumulates. By age 60, most people have lost 30 to 40% of their retinal cell density compared to age 20. The macula, the central part of your retina responsible for sharp, detailed vision, thins. The rods, cells that enable night vision, deteriorate faster than cones. This is why reading gets harder. This is why you need more light. This is why driving at night becomes terrifying. The medical term is age-related macular degeneration, or AMD for the center of vision, or simply age-related retinal degradation for overall decline. Conventional medicine offers some options: vitamin supplements, laser treatments for certain types of damage, injections for severe cases, and eventually, when cataracts develop, surgery. But Dr. Kellogg saw a different pattern. He noticed that patients who consumed certain foods seemed to maintain better vision longer. He began systematic testing, he documented everything, and he discovered that one fruit, consumed at a specific time, produced consistent, measurable improvement in visual function. What he didn't know, couldn't have known in 1900, was that this fruit contains a class of molecules called anthocyanins. These deep purple pigments have a molecular structure that allows them to cross the blood-retinal barrier, penetrate directly into retinal cells, neutralize free radicals, reduce inflammation, and actually stimulate the regeneration of rhodopsin, the light-sensitive protein in your rod cells that enables you to see in low light. He didn't know the biochemistry, but he knew it worked, and he built an entire therapeutic protocol around it at Battle Creek Health Resort. The fruit Dr. Kellogg used was the wild North American blueberry, specifically the smaller, darker variety that grew in Michigan forests near Battle Creek. Not the large, cultivated blueberries you see in supermarkets today. Those are different. The wild ones, why blueberries? And why specifically before bed? Dr. Kellogg's journals from 1900 to 1920 detail his reasoning. He observed that patients who ate blueberries in the evening reported the most dramatic improvements in morning vision. He theorized, correctly as it turns out, that something about nighttime consumption and the body's overnight repair processes created synergy. His protocol was specific. 1/2 cup of fresh wild blueberries, consumed 30 to 60 minutes before sleep, every single night, for a minimum of 14 days. He documented that patients who followed this exactly showed faster improvement than those who ate blueberries randomly throughout the day. He didn't know why. He just knew it worked better. Now we know why. Wild blueberries contain one of the highest concentrations of anthocyanins of any food on Earth. Specifically, they contain 15 different types of anthocyanins, with the primary ones being malvidin-3 glucoside, delphinidin-3 glucoside, and cyanidin-3 glucoside. 1/2 cup of wild blueberries contains approximately 180 to 240 milligrams of total anthocyanins. Compare that to regular cultivated blueberries at 80 to 120 milligrams, blackberries at 100 to 140 milligrams, red grapes at 20 to 40 milligrams. Carrots contain 0. Carrots contain beta-carotene, which is helpful, but it's a completely different mechanism. But the anthocyanins are the key. Here's what they do once they reach your retinal cells. First, they act as direct antioxidants. They donate electrons to free radicals, neutralizing them before they can damage cell membranes or DNA. Studies using electron paramagnetic resonance spectroscopy show that anthocyanins from blueberries can neutralize superoxide radicals, hydroxyl radicals, and singlet oxygen, the 3 most damaging free radical species in the eye. Second, they reduce inflammation. Age-related vision loss isn't just oxidative damage. It's chronic, low-grade inflammation in the retina. Anthocyanins inhibit the KOX2 enzyme and reduce production of inflammatory cytokines like IL-6 and TNF-alpha. Third, and this is remarkable, they stimulate rhodopsin regeneration. Rhodopsin is the protein in your rod cells that bleaches when exposed to light and must be regenerated for you to see in dim conditions. Anthocyanins accelerate this regeneration cycle. This is why people who enjoy blueberries before bed often report experiencing improved night vision within just a few days. It's quite remarkable. Dr. John Harvey Kellogg didn't have peer-reviewed studies. He had clinical observation and meticulous documentation, but modern science has validated his findings with rigorous research, time and time again. The most significant study is the Age-Related Eye Disease Study 2, known as AREDS-2, conducted by the National Eye Institute from 2006 to 2012. This massive clinical trial followed 4,203 participants, aged 50 to 85, for a period of 5 years. Participants in the highest quintile of dietary anthocyanin consumption, primarily from blueberries, blackberries, and purple grapes, showed a 25% lower risk of progression to advanced macular degeneration compared to those in the lowest quintile. That's a huge difference. Harvard Medical School published research in JAMA Ophthalmology in 2013, examining data from the Nurses' Health Study and the Health Professionals Follow-Up Study. This involved over 100,000 participants, tracked for decades. They found that people who consumed 3 or more servings per week of blueberries or similar anthocyanin-rich fruits had a 32% lower risk of developing age-related macular degeneration. That's significant protection. But here's what's really interesting. The benefit was most pronounced in people who consumed these fruits in the evening. The researchers didn't emphasize this finding, but it's in the supplementary data. Evening consumption showed an 18% greater protective effect than morning consumption. Wow. Why is that? A 2018 study in the European Journal of Nutrition explains the mechanism. Anthocyanins have a plasma half-life of about 2 to 4 hours, so if you eat blueberries before bed, peak blood levels occur during the early sleep cycles, exactly when your body is doing the most intensive cellular repair. It's perfectly timed. During deep sleep, your body increases production of growth hormone and melatonin. Both of these molecules enhance cellular repair processes. Melatonin itself is a powerful antioxidant that concentrates in the retina. When you combine elevated melatonin during sleep with circulating anthocyanins from evening blueberry consumption, you create a synergistic repair environment, a powerful combination. Dr. John Harvey Kellogg didn't know about growth hormone or melatonin. Those discoveries came decades later, but he observed the pattern: evening consumption, better results. Science has now explained why he was right. It all comes together. Dr. John Harvey Kellogg's medical journals at Battle Creek contain hundreds of case reports. One case from 1902, male patient, age 67, admitted with a complaint of severe difficulty reading. Visual acuity measured at 20/80 in the right eye, 20/70 in the left eye. After 21 days of nightly blueberry consumption, 1/2 cup, fresh, before bed, visual acuity improved to 20/50 in the right eye, 20/40 in the left eye. The patient reported the ability to read the newspaper without magnification. That's a big improvement in just 3 weeks. Another case from 1908, female patient, age 72, diabetic, reporting progressive vision loss and complete inability to see in low light conditions. After 30 days of the blueberry protocol, the patient reported significant improvement in night vision, able to navigate hallways without assistance after dark, which had been impossible previously. Simple things, made possible again. These aren't miracle cures. These are incremental, consistent improvements, from "I can't do this anymore" as to "I can manage again." That's what Dr. John Harvey Kellogg documented over and over. Small steps to reclaiming your independence. Modern examples echo these results. A 2016 case study published in the British Journal of Nutrition followed 34 patients aged 60 to 75 with early-stage macular degeneration. Participants consumed 200 grams, about 1 cup, of frozen wild blueberries daily for 16 weeks. The result? Improved visual acuity in 68% of participants, enhanced contrast sensitivity in 74%, improved light adaptation speed in 82%. No adverse effects reported. A clear win. The improvements weren't dramatic. Average visual acuity improvement was about 1 line on the eye chart. But for someone struggling to read or drive, 1 line of improvement can mean independence versus dependence. That can change everything. A Japanese study from 2019 gave participants 12 grams of freeze-dried blueberry powder daily, equivalent to about 1/2 cup of fresh berry, for 12 weeks. They measured not just visual acuity, but also retinal thickness using optical coherence tomography. a technology that can measure retinal layers down to a few microns. Incredible precision. The results showed measurable thickening of the retinal nerve fiber layer in 43% of participants. This is extraordinary, because conventional medicine considers retinal thinning essentially irreversible. But these measurements suggested actual tissue regeneration. That's incredibly exciting. Mayo Clinic researchers published a study in 2020 examining the bioavailability of anthocyanins and their accumulation in ocular tissues. Using animal models, they demonstrated that anthocyanins from blueberry consumption accumulate in the retina, retinal pigment epithelium, and even the lens. The concentration peaks 3 to 6 hours after consumption and remains elevated for up to 12 hours. That means sustained benefit. So if you eat blueberries before bed, the highest retinal concentrations occur during sleep, precisely when your cells are repairing damage from the day's oxidative stress. It's the optimal timing. So how do you actually use this information? What exactly should you do? 1/2 to 1 cup of wild blueberries consumed 30 to 60 minutes before your regular bedtime. If fresh wild blueberries aren't available, frozen wild blueberries are equally effective. Freezing doesn't significantly degrade anthocyanin content. Regular cultivated blueberries have about half the anthocyanin concentration, so you'd need to double the amount. Keep that in mind. Evening consumption, specifically 30 to 60 minutes before sleep, maximizes the overlap between peak anthocyanin blood levels and the body's natural overnight repair processes. Maximize your benefit. Raw is best. Anthocyanins are relatively heat-stable compared to some nutrients, but extended cooking above 175 degrees Fahrenheit does degrade them. Fresh or frozen and thawed to room temperature preserves maximum anthocyanin content. If you prefer a smoothie or blended preparation, that's fine. Mechanical blending doesn't destroy anthocyanins, but avoid adding heat. Simple enough. Based on Dr. John Harvey Kellogg's records and modern clinical trials, light adaptation improvements 3 to 7 days, night vision enhancement 7 to 14 days, visual acuity improvements 14 to 30 days, structural changes like retinal thickness 60 to 90 days. Be patient and consistent. Don't expect dramatic overnight transformation. Expect gradual, consistent improvement. You might first notice that reading is slightly easier, then that you don't need to turn on as many lights in the evening. Then that driving at dusk is less stressful. Small wins, building up over time. This is crucial. Natural doesn't mean without risks or appropriate for everyone. Be mindful. If you're on blood-thinning medications like warfarin or clopidogrel, blueberries contain vitamin K, which can affect clotting. This is usually not a problem with 1/2 cup daily, but consult your physician. Better safe than sorry. If you've been diagnosed with wet macular degeneration and your ophthalmologist has recommended anti-VEGF injections, do not skip those injections and try to substitute wild blueberries. Wet AMD progresses rapidly and can cause permanent vision loss within weeks. Blueberries are complementary to treatment, not a replacement. If you have acute symptoms, sudden vision loss, a sudden increase in floaters, flashes of light, a curtain, or shadow in your peripheral vision, these are emergencies. You need an ophthalmologist immediately, not dietary changes. If you're diabetic, especially if you have diabetic retinopathy, wild blueberries can be part of your strategy, but they don't replace blood sugar control, regular eye exams, or prescribed treatments. Everyone over age 60 should have a comprehensive dilated eye exam at least every 2 years, annually. If you have risk factors like diabetes, high blood pressure, or a family history of eye disease, these exams can detect problems years before you notice symptoms. Think of wild blueberries as part of a comprehensive eye health strategy that includes regular professional eye exams, blood pressure control, blood sugar control if diabetic, not smoking, UV protection for your eyes, adequate sleep, and yes, nutritional support with anthocyanin-rich foods. Wild blueberries work synergistically with other eye-healthy nutrients. Dark leafy greens high in lutein and zeaxanthin, like kale, spinach, and collard greens, should be consumed at a different meal than the berries. Omega-3 fatty acids from fish or flaxseed support retinal cell membrane integrity. Vitamin C from citrus fruits like oranges or bell peppers works with anthocyanins to enhance antioxidant effects. Zinc from pumpkin seeds or oysters is essential for rhodopsin formation and vitamin A metabolism. Don't try to eat everything at once. Build a varied diet over time that includes all these elements. The synergy between nutrients often produces better results than any single component alone. Adequate sleep. 7 to 8 hours maximizes the overnight repair processes that anthocyanins support. Hydration matters because retinal function depends on adequate fluid balance. Managing blood sugar and blood pressure is critical because even slight elevations damage retinal blood vessels over time. Wearing UV protective sunglasses outdoors reduces cumulative light damage to the retina. What to avoid? Excessive screen time without breaks. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away. For 20 seconds. Smoking is devastating. A single cigarette generates trillions of free radicals and directly damages retinal tissue. High glycemic diets accelerate retinal aging through chronic blood sugar spikes, metabolic instability from skipping meals, then binge eating, stresses all tissues, including the retina. You've just learned something that took Dr. John Harvey Kellogg years of clinical observation to discover, and modern science another century to fully explain. The specific fruit, wild blueberries, the exact timing before bed, the biological mechanism. Anthocyanins crossing the blood-retinal barrier during sleep, synergizing with your body's natural repair processes. This information isn't everywhere because it's not profitable. There's no patent on telling someone to eat wild blueberries. Pharmaceutical companies can't monetize it. Medical practices don't bill insurance for dietary advice, so even though the research exists in prestigious journals, it doesn't reach most people. Creating this video required reviewing over 40 peer-reviewed studies, historical medical archives from Battle Creek Health Resort, consultations with ophthalmologists and nutritional biochemists to verify accuracy, and careful scripting to make complex science accessible without sacrificing truth. The super thanks option below isn't just financial support, it's you saying, content like this, thoroughly researched, scientifically accurate, genuinely helpful, deserves to exist and reach more people. When you click that button, you're directly enabling more videos that educate instead of just entertain, that cite real studies instead of making empty promises, that respect your intelligence instead of relying on fear and exaggeration. If this information helps you or someone you care about preserve their vision and independence a little longer, that super thanks becomes part of a bigger mission. Democratizing health knowledge that should belong to everyone, but somehow remains buried in medical journals and historical archives. Let's make this concrete. Here's exactly what to do starting tonight. Start with 1/2 cup of wild blueberries 30 to 60 minutes before bed. If wild aren't available, use 1 cup of regular cultivated blueberries. Frozen works. Fine, thaw to room temperature, or eat partially frozen if you prefer. Don't expect immediate change. The first week is about establishing the habit, and allowing initial anthocyanin accumulation in your retinal tissues. Some people notice subtle improvements in light adaptation within 3 to 5 days. You might find that when you wake up and turn on a light, your eyes adjust slightly faster, or that looking out a window in early morning, details seem a bit sharper. Others notice nothing for the full first week. That's normal. Cellular repair is happening. Even if you don't feel it yet, keep a simple log. Each morning, rate your vision on a scale of 1 to 10. Rate how easily you can read small print. Rate how comfortable your eyes feel. You're not looking for dramatic day-to-day changes. You're looking for a trend over weeks. By week 3, most people following the protocol notice at least one improvement. Reading is easier or takes less time to focus. Night vision is improving. You can see better in dim hallways. Or when driving at dusk, eye strain after screen time is reduced. Colors seem slightly more vivid. If you're seeing improvement, continue exactly as you've been doing. If you're not noticing anything by week 3, consider these adjustments. Increase to a full cup of wild blueberries nightly. Ensure you're getting truly wild blueberries. Check the package label or buy from a reputable source. Verify you're eating them within 60 minutes of bedtime, not earlier in the evening. Add a tablespoon of full-fat yogurt or a few walnuts to enhance absorption. At the 30-day mark, assess honestly. Look at your log. Compare week 4 to week 1. Can I read more comfortably? Do I need less light for tasks? Is my night vision better? Do my eyes feel less fatigued? If you've seen measurable improvement, keep going. The benefits are cumulative. Studies show continued improvement through 90 days and sustained benefits with long-term consumption. If you've seen 0 improvement after 30 days of consistent protocol, that doesn't mean you should stop. Anthocyanin intake has long-term protective effects, even if you don't feel immediate change. But it's crucial to understand that your vision issues might stem from causes beyond what dietary anthocyanins can address. Therefore, if you haven't had one recently, schedule a comprehensive eye exam. Don't delay. Now, if your vision has worsened during those 30 days, despite diligently following the protocol, it's imperative to see an ophthalmologist immediately. Rapid vision decline can be a red flag, indicating serious conditions such as retinal detachment, acute glaucoma, or wet macular degeneration, all of which require urgent intervention, and this is non-negotiable. Go to an emergency room or see an ophthalmologist right away. If you experience sudden vision loss in one or both eyes, even if it seems temporary. Other warning signs: a sudden increase in floaters, especially if accompanied by flashes of light or the sensation of a curtain or shadow moving across your field of vision, severe eye pain combined with vision changes, the sudden onset of double vision, or any traumatic injury to the eye. These symptoms can indicate retinal detachment, acute glaucoma, retinal artery or vein occlusion, or other conditions that, tragically, can cause permanent blindness. If not treated within hours or days, this is why time is of the essence, and regardless of symptoms, if you're over 60, make it a priority to get a comprehensive dilated eye exam every 1 to 2 years. The stark reality is that many serious eye diseases have no symptoms in their early stages. Early detection through routine screening, quite literally, saves vision. So, here's what I'm really curious about. Have you noticed your vision declining as you've gotten older? What specific things are hardest now that used to be easy? Reading, driving at night, recognizing faces at a distance. And here's the real question. Would you try this wild blueberry protocol for 30 days? Or does it sound too simple to actually work? I'm genuinely curious because I hear both reactions. Some people enthusiastically say, "I'll start tonight. What have I got to lose?" Others are more skeptical, thinking, "If it were this simple, my doctor would have told me." Let me know in the comments below. If you're going to try it, write "starting tonight" and tell me what you're hoping improves. If you're skeptical, tell me why. If you've already tried something similar, share your results, positive or negative. I want to hear real experiences. And if you know someone over 60 who's struggling with their vision, please share this video with them. Remember, not every solution requires a prescription. Sometimes the most powerful interventions are the ones available to everyone.